Good afternoon. Today's discussion concerns leading and preventable cause of blindness in premature infants. This interventional study was conducted at our center, Army Hospital RNR, which is completed recently, and comparison of two intravitreal anti-VEGF, that is drugs ranibizumab and aflibercept, was done in the given concentrations. What is ROP? It is retinopathy of prematurity, a vasoproliferative disorder seen in prematurely born infants. A child is not born with it but develops it after birth, hence a preventable disease. The incidence in premature babies is 16 to 17% overall, and 68% of ROP is seen in babies born with birth weight less than 1250 grams. 80 to 100% of infants born with birth weight less than 900 grams and gestational age less than 25 weeks can develop ROP. The disease is also prevalent in nations with well-developed neonatal care. So global burden also increases with that. Vascular endothelial growth factor, responsible for the development of vasculature, plays a major role in the pathogenesis of this disease. It involves two phases. In phase 1, there is cessation of VEGF due to hypoxia, and in phase 2, there is upregulation of VEGF and angiogenic factors leading to neovascularization. As per AIOCMT3, the staging of this disease may look complex, but this slide just explains that if vascular proliferation goes unchecked due to VEGF production, it leads to contraction of retina, which is further leading to complications like retinal detachments and blindness. This is the reason emphasis is laid down on early screening, 30 days post-birth, which is also advocated by WHO and Government of India. In NICU settings, this can be carried out earlier. Management, it can be done either with laser photocoagulation or with intravitreal anti-VEGF, which is the trend being followed these days. So what do anti-VEGFs do? They act by inhibiting vasoproliferation and restoring the normal retinal function. The options available with us are bevacizumab, ranibizumab and aflibercept. We chose two drugs, ranibizumab and aflibercept, because bevacizumab is yet not approved for ROP. Based on the previous trials, which involved comparison of laser treatment and anti-VEGF like BEAT ROP, Rainbow, and with advent of newer molecules, this prospective interventional randomized controlled trial was conducted with ethical approval, which involved single blinding. CTRI approval was received in June 2023. The inclusion criteria included any children with presence of zone 1, any stage ROP with plus disease, presence of zone 1 with stage 3 ROP without plus disease, presence of zone 2, stage 2 or 3 ROP with plus disease, infant with aggressive ROP. So this was the design. 456 eyes of 228 infants were screened and 180 eyes of 90 infants were selected, out of which 88 infants were randomized and injected with either of the drugs based on the computer program. So results, these were my baseline parameters. Aggressive ROP cases in the both the groups, in aflibercept and ranibizumab. As you can see, the number of injections in aflibercept group was lesser than the number of injections required in ranibizumab group, and regression of the disease also. Also, none of the infants required a subsequent third dose in the first group, that is the aflibercept one, and even the rescue lasers were less. More eyes showed regression of disease to peripheral zone 3, hence decreasing the risk of blindness in the aflibercept group. And similar results were observed in regression of the staging as well. So previously I showed one of the case, and this was after injection, day 0, day 7, this is the right eye, and day 56, and similarly the left eye. Most importantly, the visual prognosis also increased in terms of unlasered retina, and it was superior in aflibercept group. And we could prevent the zone 1 lasers. Final results showed regression of disease after injecting aflibercept and was non-inferior to that of ranibizumab. So my take-home message in this, anti-VEGFs are effective in preventing progression of ROP, and aflibercept 1 mg in 0.025 ml is as efficacious as 0.25 mg in 0.025 ml of ranibizumab. Also, we can prevent the central lasers, zone 1 lasers, hence giving a better visual prognosis to the children. Thank you.
case, how was single blinding done? You mentioned that.
Ma'am, only the person who was injecting did not know which injection was being.
Only the person?
The doctor. Yes, only the one person.
So the investigators were aware?
Yes.
The investigators were
Yes.
aware.
Yes.
So the that person is not an investigator who was giving the drug?
No.
Okay.